Good evening and welcome. Let's take a look at the top story that we're tracking for you. The coronavirus continues to wreak havoc across the world. There are new strains being found, new studies being done to understand the nature and the impact of the virus. And the latest update coming in is that the UK's highly transmissible mutant COVID strain is in fact even more deadly as compared to the existing strains. UK Prime Minister Boris Johnson made the announcement on Friday.
I must tell you this afternoon that we've been informed today that in addition to spreading more quickly, it also now appears that there is some evidence that the new variant, the variant that was first identified in London and the South East, may be associated with a higher degree of mortality.
This news comes in as the UK registered its record highest deaths since the beginning of the pandemic. British Prime Minister Boris Johnson blamed the mutant virus for this overwhelming surge in coronavirus infections. The strain was first identified in southeast England in September, and since then the mutant virus has spread to more than 60 nations, including China, where the pandemic began more than a year ago. Britain is witnessing the third and worst yet surge of coronavirus. Over the past week, COVID-related deaths have risen by 16%. And cases that require hospitalization have seen an exponential rise. And experts say that the cases that require emergency attention are now double of what it was back in April of last year, the time when the virus was at its highest peak in Europe.
The NHS is under such intense pressure, with another 40,261 positive cases since yesterday. We have 38,562 COVID patients now in hospital. That's 78% higher than the first peak in April. And tragically, there have been a further 1,401 deaths.
But it's not just all bad news. Britain's chief medical officer has said that the R number is going down, the first time since December. The R number is a measure to determine whether the pandemic is growing or shrinking.
I'm glad to say that in the most recent data, there has been a turning of the corner on that, and the number of people with infections has gone down. But it has gone down from an exceptionally high level, and their most recent estimate is we're still at a stage in England where 1 in 55 people have the virus.
The situation in the UK remains grim, and Britain's planning their hopes of return to normalcy on its biggest vaccination programme. Prime Minister Johnson assured the nation on Friday that as per the latest evidence, all approved vaccines are effective against the mutant strains. Britain started its vaccination drive in December last year.
All current evidence continues to show that both the vaccines we're currently using remain effective both against the old variant and this new variant. And so you'll also want to know that our immunisation programme continues at an unprecedented rate. 5.4 million people across the UK have now received their first dose of the vaccine, and over the last 24 hours we can report a record 400,000 vaccinations.
Earlier we spoke to clinical virologist at the University of Leicester, Dr. Julian Tang, on this issue. Let's listen in to what he had to say.
So what they did is they looked at the proportion of the new variant in the positive samples just before Christmas, and they assessed that there were more positive samples due to this new variant than there were previously, and this was rising over time from October, November. And that's how they estimated that this variant is 50 to 70% more effective, more transmissible. And a couple of other modelling studies showed something similar, between 50 to 70% more transmissible, based on the increasing proportion of positive samples that were including this UK variant. There are some caveats to that. There was more social mixing before Christmas, up to Christmas and then New Year. There was the pre-Christmas shopping period. People coming out of lockdown in November, going back into the streets in the Tier 2 in London and South East and Kent, mixing more freely and non-essential shopping. And then, of course, there's the Christmas Day amnesty, where they had up to 3 households mixing under one roof. So all these people movements could also increase the transmission of the virus regardless of the new variant. But of course, winter indoors, people are often more indoors, and they transmit the virus in a more crowded environment. And we see this every year with influenza, for example. So I think there's a mixture of both people and more intense social mixing before Christmas, after Christmas and New Year, as well as any intrinsic genetic variability of the virus that may increase the apparent transmissibility when assessed in that manner.
WION, now available in your country. Download the app now. Get all the news on the move.